My name is Ayesha Khalid, and I am an ear, nose, and throat physician here at CHA. I'm chief of the Division of Otolaryngology, or ear, nose, and throat surgery, and I'm also a clinical instructor at Harvard Medical School. I became a doctor because I really love taking care of people, and I also love hearing about what makes them tick, what makes them feel happy, what makes them sad. I wanted a field that involved having surgery and working with my hands, but at the same time, I wanted to be able to have a longer-term relationship with the patient. And ear, nose, and throat surgery, like some of the other surgical specialties, allows you to have a longer-term relationship with patients, and a lot of times prevent the need for surgery for patients. I feel like that was really attractive to me. I usually approach patients with the following: what brought you here? And if you could wave a magic wand and fix 2 symptoms or 2 things that are bothering you, what would they be? A lot of times patients ask me, well, what do you think I should do? Do you think I should have surgery? Do you think I should have allergy testing? Do you think my snoring requires the CPAP? And I often say, well, it depends how much it bothers you. If it's clear to me that you don't have a tumor or possible cancer, which is of course in a different category, and I will tell you this is something that I feel we need to do, I usually leave it up to the patient, and I usually don't sign them up for a surgical procedure on our first visit. But I often tell them, like, here's what it might involve, like go home, think about it, come back in a few weeks, or let's do a televisit and talk about it. And I think that often leads to patients deciding when they're ready to make the commitment, not just if they're having surgery, but also taking the time off and making sure their schedules work. I think that leads to a better result. I think what really cheers me up is when patients say it was life-changing for them, whether it was that they're able to now go to work and function, or they're able to go back into the bedroom with their significant other or partner and be able to sleep without bothering them or having issues the entire night with their sleep or their snoring. I also think, though, that the most gratifying is when they say that somebody listened to them. When patients say to me, you're the first doctor that's listened to me for a few minutes rather than just said, why are you here and how can I help you and what do you need? For me personally, that's the most gratifying, because I think patients have a lot to say. And unfortunately in healthcare, we're so overwhelmed. We want to spend more time with them, but a lot of times we don't have the time. So I love that. That really makes my day, and that actually isn't doing surgery on someone, but I feel like that's when I go home the happiest.